Dr. Tracy, pediatrician, and there is a complaint that I am getting more and more in the office that I thought it would be helpful to address because I know that I can't be the only provider this is happening to. So when you go to see your primary care provider, whether that's your family practice provider, pediatrician, there's a lot of pre-screening forms to be done, right? So there's depression screening forms, anxiety screening forms, there's developmental screening forms. There's a lot of screening forms. We're even screening now for postpartum depression. We're screening for what we call social determinants of health, which is just making sure that the family has access to transportation and safe housing, and they don't have any food insecurity. So there's a lot of pre-screening that is done. Sometimes these forms are billed in insurance because the provider that has to interpret them, so a medical form, like a depression form or anxiety, we use those to screen and then diagnose. And so those have to be billed for when we do our billing. And I'm getting some families that are really upset about this and don't understand why it's happening. So I want to explain this a little bit. First of all, your doctor does not make the rules for that. So we do not set which things should be billed by insurance and which things should not be billed by insurance. We have contracts with insurance companies just like you have a contract with your insurance company. And if we use a diagnostic tool to make a diagnosis, we have to bill for it. There's two reasons for that. The first one is it's insurance fraud not to. You're supposed to. The second one is there is a lot of insurance companies, including Medicaid and Medicare, that track the amount of screenings that doctors do in order to determine are they doing best practices. So if we're not screening every teenager for depression, then we get either talked to or dinged or not reimbursed at the highest rate if we are not following what is considered best practices. And so the only way for them to know that that's happening is if a billing code is put in. So a lot of times it's automatic. If I do a depression screening called a PHQ-9 in an adolescent, it automatically gets billed. So that is not your provider trying to charge you extra for a wellness visit. It is standard of care, and we don't have a lot of choice on it. So that's a discussion to have with your insurance company, not your provider. Now, having said that, never is it our intention to charge you for something that you are just filling out a form. So if it is ever a financial hardship to pay for a screening tool, you just talk to us. Like, we don't mind. I've definitely had times where I have been able to say, yeah, I understand your insurance company doesn't pay for this. I can work something out on my end. So always talk to us. Don't refuse to sign the forms and let your child fill out the forms just because of that billing issue. Talk to us about it first, because the only thing that truly matters is that your child gets the screenings that they're due for and gets the care that they need. The rest of it we can work out. So I hope this helps a little bit. Again, I can't be the only one experiencing this. So if you have any questions about how things like insurance works, definitely ask, because I think that we need to all be talking about this more so it's not confusing. Take care.